Introducing spironolactone, also known as aldactone. Another drug in this category is eplerenone, also known as Inspra. Spironolactone is an aldosterone antagonist, but its therapeutic classification is that it is a potassium-sparing diuretic. You should take precaution with spironolactone if you are breastfeeding, dehydrated, you have a hepatic disease, renal impairment, electrolyte imbalance, metabolic acidosis, or if you are pregnant, because this drug is a pregnancy class C. The mechanism of spironolactone is that it blocks receptors for aldosterone while also binds with receptors for other steroid hormones. The blockade of aldosterone receptors is beneficial in the treatment of hypertension and heart failure because it promotes excretion of sodium in water, thus reducing blood volume. The dosage for spironolactone for an adult is typically between 25 to 100 milligrams per day. It is dispensed in tablets for oral dosing that can be taken with or without food. Contraindications. Spironolactone is contraindicated in clients who have increased potassium levels, kidney impairment, and type 2 diabetes. The side effects of spironolactone include hyperkalemia as the main concern, possible bleeding, and then hepatocellular toxicity and agranulocytosis. Gynecomastia can also occur, and so can menstrual irregularities, which is due to the steroid hormones that can cause these adverse effects. Interactions. Spironolactone can increase the action of antihypertensive medications, digoxin, lithium, and then whenever it's combined with other potassium products, we once again worry about hyperkalemia. Those can include ACE inhibitors and then salt substitutes. We need to inform our patients to watch out for those. And then NSAIDs can also decrease the effects of spironolactone. Some nursing considerations that we need to be aware of is that we need to assess our patients for hypokalemia and hyperkalemia. We need to monitor their intake and output, and we need to monitor for confusion of their mental status. Also, inform your patients that they need to avoid food with high potassium, such as oranges, bananas, and then of course the salt substitute, and then inform them that they should not notify their doctor if cramps, diarrhea, thirst, headache, and anything in that sort occur.
Created using Powtoon.